Hello, everyone. Today I am here with Dr. Julia, and I'm so excited because this is the first time we have like a behavior specialist on with us, and she's really going to take a deep dive into depression, all these anxiety feelings, and a lot of stress management, especially with autoimmune conditions. She's going to share how she deals with patients who have these conditions and have these sort of issues as well around stress management. So let's kick it off with your story, Dr. Julia, and why you got into this and why you're interested in working with chronic illness patients.
Well, thank you so much for having me. I'm really excited to be here and just talk about, some things that I think can be really helpful in general, just for managing chronic illness, especially autoimmune disorders. There can be a lot of challenges that come up with that. So I think it's helpful to have some, tools that can be used kind of, on the regular that can be very helpful with management. So just a little bit about me. So I am a health psychologist, and I specialize in stress, anxiety management, and it is all a part of behavioral medicine. So basically, what we do is we help people make small changes in their lifestyle in a lot of different areas that can really support good mood, coping with any kind of chronic illness. So really, my role is to work with people to see what makes sense to change in their lifestyle that can really help support their goals. So currently, I am the coordinator of a primary care behavioral health program at one of our large hospitals here in Chicago. And so what that program is really designed to do is to stop treating physical and emotional health as two separate things. It's really to look at the person from kind of an integrative, holistic perspective, because, most physical conditions have an emotional component to them. A lot of emotional kind of distress can lead to physical symptoms and things that might mimic medical conditions. So this program is basically designed to start treating the person as a whole and really see all the different areas that we can address to really help them, live the life that they want, basically. So that's been really awesome for me, just to see, how many positive changes we've been able to make with people. And currently I do that. And then I also do just some private coaching for stress and anxiety management. Quite a few people I have are suffering from autoimmune disorders or other kinds of chronic illness. So kind of a similar approach of really just looking at the person as a whole and seeing what we can do to help support them. So I'm looking forward to, chatting further about some of these topics today as well.
Awesome. Yeah. I mean, I work with a lot of women who have they've been on antidepressant medications or anti-anxiety medications, and they're trying to get off of them. A lot of them have Hashimoto's. What do you suggest
for getting off the medication?
Well, you like just dealing with anxiety and depression when you have Hashimoto's.
Mm-hmm. Yeah, that's a great question. I think that, for any kind of treatment of anxiety, depression, any kind of mood management, it's really important to look at various factors. So it's going to be a little bit different for depression and anxiety. But, with anxiety, for example, it is a very physiological response. So when we get anxious, our heart rate goes up, our blood pressure goes up, we have more muscle tension. This can lead to digestive issues as well. So a whole host of kind of physical symptoms happen very quickly. So one part of anxiety management specifically that's really important is having strategies to calm the stress response in the body. So that's going to be things like regularly doing deep breathing exercises, progressive muscle relaxation. These are tools that actually cause a physical change in the body. It could really help bring down kind of stress, irritability, anything like that. It can also help with sleep as well, which can be something that is difficult for people suffering from both anxiety and depression, especially if they kind of have both. But then what applies, I would say, to both a little bit more generally is, our behaviors have a lot to do with how we're feeling. So when we're feeling depressed, let's say, there is a tendency to say like, I don't feel like doing this today. I don't really want to talk to, friends or family. I kind of just want to isolate or be on my own. When we are feeling anxious, there's a tendency to maybe avoid things that give us anxiety, procrastinate, which can cause more anxiety. So looking at our behaviors and what happens when we do experience mood changes is a really important piece of management, as well as kind of getting it on the front end of how do we put activities and stress relief outlets into our life as more of a preventative measure that we're doing regularly, no matter how we're feeling. So that can help also just prevent certain mood symptoms from getting as high as well. So there's kind of this behavioral aspect of both. And the cognitive piece is also a really big piece of both as well. So our thoughts have a lot of power over how we feel. So with, those suffering from like Hashimoto's, for example, or other kinds of chronic illness, the probably most common thing I see is there's a lot of focus on things that we can't do anymore. So I used to do all of these things and, I can't do them anymore, which, there is perhaps some relevance to that. But the more that we focus on how our life has changed, maybe not in the way that we would like, that in itself can be very distressing, anxiety provoking, depressing. So I think that's probably like a top kind of thought process that can really bring down the mood. And that's something that I think a lot of people experience. So that's just one example, but there's a lot of other kinds of not very helpful thoughts that can come up when we're feeling anxious or depressed. So let's say we're feeling kind of down or depressed. The mind is going to automatically try to think about everything else that's not going well. So maybe we're struggling at work or we're struggling in the relationship. It will try to kind of pull everything else it can think of at the same time. So now we're not only kind of dealing with maybe some of the negative effects of how we're feeling physically, but now we're also thinking about everything else that's not maybe going well. And it's kind of this very, it's almost like a binocular that's only focused on what's not going well or negative things. And that in itself, just that thought process, it can cause more depression, and it can also increase certain physical symptoms or any pain conditions as well. So that's kind of like a very broad overview, but kind of my point in sharing that is there's a lot of things that can be done from a lot of different angles to help with mood, to help with coping with any kind of medical changes. And so I do certainly want to encourage people that there's a lot of directions that you can go in to really notice some, I think, pretty good changes in mood by looking at a variety of these different areas.
Wow. So that's very insightful. And I know at the beginning of this conversation, you mentioned the physical aspect and the emotional aspect sort of working together. How so? Like, can you give us some examples of people you've dealt with who have had chronic illness?
Yeah, absolutely. So just to give you a very straightforward example of just, let's say, high blood pressure. It's just like a really simple one. So I'll just start there. So when we are suffering from, let's say, high blood pressure, we can take medication, we can follow maybe a low sodium diet. But anytime that we're getting really anxious, angry, irritable, that also causes our blood pressure to go up, for example. So that can be something that can really impact physically, and then high blood pressure can in return also cause more irritability and cause anxiety. So with autoimmune disorders, generally speaking, so things that can come up that are perhaps part of, like Hashimoto's, for example, is like this mental kind of, let's say, fogginess or maybe low energy that can just come from that. So what might happen there? So this is kind of, let's say, the more medical piece of it. But when we are low energy and not feeling so good, that's where this tendency to not want to do much, understandably so, right? If we're not feeling well and we have low energy, we're probably gonna not want to do as much. But now what ends up happening is now we're not doing as much. So now we have kind of all the time in the world and all the focus in the world to really focus on, we're not feeling well, we're low energy, all the changes we're going through. So now, as a result of thinking about all these things and spending a considerable amount of time there, now we're more likely probably to feel a little bit more down, depressed, maybe anxious. Now, and this is, kind of just an example of how the cycle might go, but when we feel down and depressed, this is always going to zap our energy and motivation just naturally. So if we already had the low energy, let's say, from the medical condition, now we're feeling, let's say, more down and depressed, it's going to kind of further pull the energy. So then it becomes kind of it's hard sometimes to tease it apart. So that's one example. With anxiety, let's say that, someone is experiencing some sleep issues, which can be, common as well. When we're not sleeping well, this can increase anxiety. When we're feeling more anxious, now this is going to lead to more muscle tension. More muscle tension can lead to things like more irritability, or also just make it hard to sleep again. So now all these things are very kind of integrated together. And so that's why, only looking at things from a medical perspective, it tends not to be the full picture, because really I can think of almost any condition that we can talk about. There is always going to be some interaction between our emotional well-being and kind of those factors and our physical health.
Yeah, that's so true. And I think even with me, like I've never had high blood pressure or anything of that sort, but I kind of catch myself when I'm like getting anxious and like trying to get a bunch of stuff done at one time. And then, all these sort of like, it's like when it rains, it pours, and sometimes people just get a streak of these crazy events that happen in their lives, and then they fall into depression. And then when they do that, like, do you like I know a lot of people take medication like SSRIs. What's your take on that?
It's hard to answer that super directly, because I think it really, really depends on a case by case basis. I think that in certain situations, especially depending on the severity of, let's say, depression or anxiety, I think there is a place for SSRIs and they can be helpful. However, it without tools to go along with that, then the SSRI is treating the symptoms, but it's not giving kind of additional tools to be able to cope without the medication. And so it's really going to kind of depend. But I would say if someone's at kind of, let's say, a mild to moderate level of anxiety or depression, they could perhaps do very well without medication. The more kind of severe either of those get, the more I think medication does probably play a role. Because let's say someone is severely depressed, trying to learn tools or learn anything really when we're severely depressed, because it does take, it causes mental fogginess really, and it can zap our attention and concentration too. So trying to learn tools if we're severely depressed, it's extremely challenging. So in a case like that, medication might be very effective and allow that person to be in a space where they can gain some more tools. With anxiety specifically, this is the behavioral medicine person in me, but I think that one really responds better in the long term to tool-based approaches. How do we calm the stress response in the body? How do we make sure we have stress outlets and ways of dealing with a lot on our mind, let's say? How do we make sure that our sleep is kind of quality and not being impacted kind of if we're feeling anxious, or if we're not sleeping well, how do we manage anxiety that can come along with that? So it really is going to be a case-by-case basis. But with any person, no matter who we're talking about or the severity, for long-term management, having a series of tools in kind of like your toolbox, so to speak, that's ultimately, I think, what's going to be the most helpful in the long term.
That's so true. I want to learn more about the tools that you're talking about, because when I was dealing with this, and I can totally relate when you said we kind of envision ourselves like what we used to be and what we used to be able to do. And I kind of did that for a while, because like when you start looking different, when you start, physically not looking as appealing as you did before, it kind of tapers your confidence in a little ways. So I think that, with that, it kind of could lead to depression. And for me, it was kind of about like, how can I take this energy that I'm feeling and refocus it on, my contribution to the world. How I'm putting all this energy into like feeling depressed and like not feeling good about myself. How can I refocus that energy into something that can help others, and that will then be more rewarding to me than how I'm feeling? So, I mean, that was my tool. So maybe you can go through your tools.
Mm-hmm. So, with depression and anxiety, they have similar approaches, but there are some differences just because they're just different in kind of just how they manifest and how they work. So would it be helpful to kind of talk about both, or did you want me to start with one specifically?
Either way, like you can talk about them differently if you'd like, separately.
Okay. So, I mean, they do have some similarities, but I think, what you just mentioned is probably one of the biggest things that people struggle with anytime they have any kind of chronic illness or a big medical change is how do I adjust and kind of start to adapt to this? So that is always going to be challenging. So getting through that is not easy. And I think it is a natural part of the process at some point to experience a sense of loss of perhaps things you did in your, before that maybe you're not doing anymore. So I think there is this kind of sense of loss that does need to be worked through. But as you identified, we want to start to adapt and think about, so yes, it's perhaps true that these are things I'm not able to do anymore, or they don't make sense for me to do anymore. So what do I want to focus my energy on? And so it might be similar to things we were doing before, or it might be completely new and different things, but we want to try to kind of meet ourselves where we're at in the now and where we see that going. Because with depression especially, there is a tendency to our thoughts to get very stuck in the past. So past mistakes, I wish I had done this differently. If only this hadn't happened to me, this could be happening. And although these thoughts are a very normal part of, I think, just feeling depressed or going through a big change, the amount of weight that we give those thoughts is very much going to determine kind of where our mood goes. So trying to kind of focus on, it's kind of a balance of acceptance and adjustment. So acceptance of, I don't need to be happy about this, and I'm not happy about this, but I have acknowledged that this is the situation here. So that's kind of like this level of acceptance of this is the situation, even if we're not happy about it. It does take some time to get there. So this is not an immediate thing. So I do like to just, point that out too. But now that I have accepted that this is kind of what it is moving forward, how do I now live within that is in line with my values, my interests, my goals, even if those might be different ones? And so I think it's kind of very much a process of working towards that acceptance piece, which does take some time, and also figuring out what do I want my life to look like now, moving forward this way. So that's, kind of one piece of it. I think, with any uncertainty, especially when something's new, so adjusting to a new illness, let's say, that's always going to drive anxiety quite a bit. And when we get anxious, that can also really take our attention and concentration, because when we get anxious, we tend to very much get in our head, and the thoughts kind of like start to feel like they're just like going like this, right? Yeah. And they're not very helpful. So having tools, I think, to manage anxiety is important for everyone, but especially when going through a big change or trying to figure out new things. So, that's going to include some things that I mentioned of noticing early signs of anxiety. So I think this is probably the piece that's missed the most, is we want to be doing things on a regular basis to prevent anxiety, but also to catch it early. So once we're at like a 10 out of 10 on the anxiety scale, our attention has gone out the window, we're feeling really overwhelmed and anxious, it's going to be much harder to bring it down. But if we can catch it in the earlier stages and notice what are my early clues that I'm starting to kind of go in that direction, the earlier we can catch it, the faster we can do something about it, and the less negative impact it's going to have. So if with anxiety management, that's really important, but also same thing with kind of depression. So we want to be able to recognize what are the earliest signs that I'm either starting to feel depressed, or this depression that I'm experiencing is going in a more severe direction. So catching these things early and also doing things regularly for prevention, I think personally are the most important things, because it takes a lot less investment and energy to kind of catch it early and do something about it than to try to do things when we're already, let's say, really anxious or really depressed. There's of course still things that can be done, but it's a lot less kind of distress and energy if we can catch it earlier.
Yeah, exactly. I mean, even when I was walking through this process, it's hard because you have these symptoms, and it's kind of like a mind over the body thing, and you don't really understand why these things are happening, why the health has to be so uncertain. And that kind of leads into these sort of behaviors. But something that I've noticed is that a lot of the women I've worked with have, weight issues. Like they want to be a certain weight, or they want to lose a certain amount of weight. And connecting that with, I guess, life happiness, confidence. Do you see that often in this environment as well?
Absolutely. I think that, confidence being wrapped up in weight, I think is something that women especially struggle with. I mean, anyone, of course, can struggle with that, but women, especially who are, let's say, doing things that maybe they used to do and were able to maintain their weight, but now after having some of the symptoms of, let's say, Hashimoto's or other kinds of disorders, it's not going to maybe be the same. They might not be able to do the same things and get the same results. And that can be distressing and it can be upsetting. And so I think just in general, there's a lot of pressure on women with kind of around their weight. So I think there's a lot of kind of different ways to go in that direction. So one is focusing on lifestyle factors and things that we're doing to support, let's say, a healthy weight or just kind of overall health. That can tend to make us feel better because we're able to see progress on a more regular basis than kind of looking at a scale, let's say. So let's say someone sets a goal of, okay, to maintain a healthy weight, I'm going to really focus on exercising 3 times a week. So when we exercise those 3 times a week, that can give us kind of more motivation and make us feel good, even if it's not directly kind of looking at the scale number. It's just a little bit more motivating than looking at a scale. So that's, I think, one aspect of it. The other aspect kind of goes to, something that we just talked about a few moments ago is also kind of a level of certain acceptance depending on what the situation is. So maybe it's an acceptance that what I used to do to help me be whatever wherever I wanted to be, that might not be the thing that I do anymore. And that is frustrating. But how do I want to kind of see what else I might do? For some people, if there's kind of just depending on, what the thyroid is up to, if the kind of weight is not budging despite all kinds of different efforts, then there might be a kind of different level of acceptance and refocusing on other things that they value that can still be helpful in that regard as well.
I see. Yeah. I mean, at the end of the day, we have to figure out a way to live in this body and be happy with what we have, and it can always be worse. But I think if you're trying your best, like with lifestyle, health, what you're eating, and, exercise, then it's kind of like you have to learn how to be happy. I mean, it doesn't necessarily have to be a certain size or a certain weight. And I think, some people with their genetic makeup, they would just have to work harder than other people to get a certain weight if they want to get that, weight of like whatever, 110 pounds, whatever it may be, or lose the 5 extra pounds. And it's like, are they willing to sacrifice a portion of their life to dedicate time to doing that, and that's not everyone has the time to spend 3-4 hours in the gym every day. So that's something that I guess you have to think about is, hey, you can get that look, but do you want to spend this much time? Do you want to really put in the effort that it takes, or do you want to just be happy with what you have? And that's kind of the choice we have, I guess, especially dealing with Hashimoto's. I know me because I've been in the media and I've been in the public all the time, and that was a concern because I'm like, okay, I cannot, like, everyone's looking at me, I have to take pictures, and it's kind of humiliating. But at that time, I didn't have a family or anything like that, so I did have the time to put in the effort to be able to, knock off the pounds. But it wasn't like a walk in the park for sure. So yeah.
I think this topic is really tough for a lot of reasons, but I think the other thing to consider too is kind of asking ourselves, what is the reason I'm putting this intense pressure on myself to be this weight or to, be able to do or wear this? And I think that can give some good information too. So when we really kind of dig into where is this pressure coming from? So if it is, let's say, well, a lot of our confidence is put into our weight and not much else, I think that gives us a lot of room to work with to build confidence in other areas. Or is it because we're worried that, I don't know, a partner is gonna not be attracted to us anymore? That, I think, probably gives us also some things to kind of, consider, work through, kind of acknowledge, because, the weight is kind of this this, okay, this is our weight, but what's really under that? What is the importance of it? What is the significance of it? Are there other ways to maybe achieve some of the things that are tied into the weight, or to address maybe some concerns that are being kind of on the surface presented as weight?
Mhm.
Are there other things that maybe we can address there? And for the most part, it tends to be the case.
That's a better answer than I could have came up with. A lot better. But yeah, like so when you see people with autoimmune conditions, what sort of behaviors do you usually see in terms of, are there certain things that are similar, commonalities? Why don't we take a deep dive into that?
In terms of just kind of like across the board, what are some of the most common things?
Yes.
Yeah, I think so a few things, and it's going to be different, of course, for everyone, but I think some of the most common things is one of the things I mentioned a while back is just in terms of kind of what we focus on, a lot of focus on things that we can't necessarily do anymore. So I think that's probably like the number one that I see really across the board. So that's a really important one to address. Number two, I would say, and this is a really hard one because, with Hashimoto's, it can be very draining from like a physical standpoint. It can really kind of take away energy. So there's kind of this tendency to go with how we're feeling a lot of the time, which technically makes sense. If we're not feeling energetic, we're probably not going to want to be doing certain things, but that can also, like we talked about, lead to depression, a lot more focus on what we can't do, a lot more focus on how we're not feeling well. So finding ways to try to have kind of a regular activity that might fluctuate some, but really trying to kind of set goals that are realistic around what can I do most days, regardless of how I'm kind of maybe fluctuating. So this is something we call activity pacing. So there is a tendency for a lot of people to one day they'll kind of wake up and they'll be like, I'm energetic, like let's do everything possible today, and let's go for a 10-mile bike ride and do all these things. And in theory that is nice, but what ends up happening is then the next day they kind of go all the way to the opposite end of like being completely drained and just having zero energy for anything. So that's where this activity pacing comes in. We want to really try to have a somewhat kind of moderate activity level, whatever that would be for the person, most days, rather than kind of going to extremes. That can also be helpful for generally just kind of consistency in some of the things that we're doing to support mood. It can also help prevent some of these kind of like energy kind of hills and valleys, which is going to happen naturally anyways, but it can help them not be quite as severe.
That's true. And in terms of like protocols, are there certain ways you have dealt with people who have autoimmune conditions, and what type of protocols do you recommend?
For like a treatment for specifically the conditions or mood, would you say?
Mostly like conditions like depression, anxiety. I think those are the top two.
Mm-hmm. Yeah, absolutely. So in terms of kind of, chronic illness, just coping in general, a bio kind of psychosocial model is what we take at the hospital and I take personally, which is really looking at all of these different factors that we just talked about. So what are the physical contributions that we can address through non kind of, medical or medicine approaches? What are the behaviors that we want to address that are going to help support mood management, help support a low stress lifestyle? So that may be things like physical activity, what we're eating, how we're sleeping, what we're doing for stress. What are the thoughts that are perhaps natural, but are really kind of driving anxiety or bringing down mood in depression? So addressing those. Are there any spiritual or kind of religious factors that might be important to the person and that they might value that can also kind of go into how they approach their treatment? So really kind of looking at all of those things is one big aspect of it. And within that, there's a lot of tools from two kind of, I would say, main therapy approaches. One is called cognitive behavioral therapy. So this is kind of a highly evidence-backed therapy, tons of years of research. So basically it looks at basically kind of what we just talked about. How do our behaviors and our thoughts influence our mood, and how do they all connect? So that for depression and anxiety is very effective. And then also there's another kind of therapy called acceptance and commitment therapy. which I'm a big fan of. That includes also some of the things that we've talked about is kind of working on being present with where we are now. Anxiety is always going to try to kind of take us into the future of what's going to happen in the future. Depression tries to kind of take us into the past to focus on all the things that, you know, we're not happy about. Acceptance and commitment therapy is very much about kind of how do we stay here and work through whatever's happening kind of in the now. So I like to use a variety of those approaches, but if someone was looking for a more, let's say, formal therapy approach, I would recommend one of those two. So cognitive behavioral therapy or acceptance and commitment therapy are very effective for both.
That's great. Yeah, they both sound like they would work pretty well, especially with women who are dealing with autoimmune conditions and even like chronic illness. Uh,
Mhm.
so like, is there something like that causes certain behaviors you would say that cause these autoimmune conditions, or is it the conditions themselves that cause these behaviors, you think?
And like what kind of behaviors are you referring to?
Like even are there certain like behaviors that people have even before they have autoimmune conditions that then trigger these conditions, or
Mhm.
is it the other way around where they start, they find out they have Hashimoto's and the next day they're living in depression. So
Mhm.
what came first, do you think?
So that's a really good question. So with autoimmune disorders in general, they're kind of this very much still unknown. Obviously, we know quite a bit about them, but what actually causes them, there's still not a firm kind of conclusion in a lot of cases. So sometimes it can be due to a virus, sometimes it can be due to a certain kind of bacteria, sometimes people can be genetically predisposed, and so it can be from so many different things. And I think that's why it can be frustrating for people, especially because this is where this uncertainty comes in. So did I do this? Is this because of something else? And, I always like to encourage people to remember that autoimmune disorders, especially, there's so many kind of ways that they can come about, and it can be frustrating not to know the answer. But I always encourage people to not, blame themselves, especially in this case, because there's just so many factors that can lead to them. But that being said, with dealing with a new chronic illness, with Hashimoto's specifically, depressed mood can be a symptom of the condition from chemical changes. So then when we are having these chemical changes, and now we actually from like a medical standpoint are having, let's say, lower energy, we're having depressed mood, that can further lead then to some of these other things we're talking about. So more depressed mood, kind of lower energy, that's where our behaviors might come in. So some people might decide to cope with alcohol, cigarettes, avoidance of people, in their life. Other people might choose, just to kind of isolate and not talk to anyone. Others might, and this is very common with anxiety in general, but especially as it applies to kind of uncertainty with medical conditions, a lot of kind of what if. So what if I'm never able to lose this weight I want? What if, I'm always gonna struggle with this? What if, I could probably come up with 50 different random ones, but the what if train, once the what if train gets going, that is like a perfect route to anxiety.
Mhm.
So kind of monitoring those things. And once that what if train gets going, that can really cause more anxiety. That can lead to behaviors like having difficulty sleeping, or maybe, further avoiding things we need to do. So it's all very related. But, coping with a chronic illness, it's really challenging, and it can lead to depression, both from by nature of the illness, but also how we then kind of cope with it after that. So it can kind of, go in both directions there.
That's interesting. Yeah, I mean, for me, I wish I had looked into my genetics even when I got diagnosed with my first autoimmune condition, because that held a lot of weight. I mean, once you're predisposed to any of these autoimmune conditions through your genetics, it kind of opens you up to, like I would have been more cautious around my environment, what I put in my body, like my hygiene, everything, but at the time I just didn't know. Like, and when the doctor tells you that there's no cause, or they don't know the cause, or they don't know why it happened, or if it'll ever happen again, it's kind of like, okay, that's anxiety in itself, you know? So,
Mhm.
yeah, I mean, I think that caused more anxiety than anything else in the experience. And knowing that, it's like, hey, could I have another autoimmune condition? Could I, you know, like have this relapse again? What if I get a flare? Could I travel with this? Like, you get all these different thoughts, and they kind of just keep going. And it's like, it's kind of like that what if train, because there's so many uncertainties around your health. So,
Absolutely.
um, yeah, my goal was to be able to optimize my health and at least get it into a place where some of these things are a little more controllable, even in an uncertain world. I mean, yeah, I can go to Zimbabwe, catch an infection, and probably get an autoimmune condition, but how is my immune system going to be when I go to Zimbabwe, right? So these are things I think we can control as people, make sure that we have a great immune system, make sure that, we don't already have inflammation, we're not under a lot of stress. So, and I think that's the last topic that we didn't really touch upon was stress. Like, a lot of people, I think they have stress and may not even know it. Do you ever see that?
I see this every day almost. So everyone experiences stress. So stress is not necessarily a bad thing. And in fact, a moderate amount of stress is good for us. That's what kind of gives us like a kick in the butt to get the day going, do what we need to do. If we had zero stress, then we'd all kind of be kind of like laissez-faire, la-di-da all day and probably not accomplish much. Now, so some stress is good, but when stress starts to become too high, too frequent, or is not managed very well, that's when it starts to interfere in our life. So that's when we're going to start to have sleep issues. That's when we're going to start to have different kinds of digestive system issues. So like constipation, diarrhea, stomach cramps. We're going to have more perhaps high blood pressure, muscle tension. So if you already have pain somewhere, let's say you have pain in your shoulder, if you have more muscle tension now, you're kind of constantly in a state of tension. It's going to be hard not to experience pain there. And that could be anywhere throughout the body. You mentioned, immune system. So chronic stress that's not well managed, that can weaken the immune system. And the reason for that is because stress is always going to release different kinds of kind of chemicals that can make it very hard for the immune system to fight against. So cortisol is kind of like a stress hormone that can really cause the immune system to be weakened, especially if it's kind of chronic stress. So a lot of people experience these symptoms in their daily life, but they don't necessarily know it's due to stress. They know that this doesn't feel good, that I don't like feeling this way, but a lot of people don't know that a lot of these things are caused by stress. And so that's why, especially for any kind of chronic illness, it's really, really important to be managing stress on a regular basis because, we don't need any of these things on top of, the kind of individual things people are experiencing. So it's a really, really big part of it. And it really goes back to what we've been talking about. So doing things on a daily basis to manage stress. So we want to kind of master the stress rather than the reverse, the stress mastering us and telling us when it's time to do something. We want to be kind of getting it at the front end of, on a daily basis, let's say, taking some time to do 5 minutes of deep breathing. It doesn't need to be like crazy major things. Taking time to think about what we have to do and our plan for it, spending a few minutes calling a friend. So these are things that I recommend to everyone to be doing on a regular basis. This helps prevent stress, but it also helps it from getting to a point where we're experiencing all of those symptoms. And so I think this is extremely, extremely important, not just for everyone, but especially for people who are experiencing other kinds of symptoms related to any kind of autoimmune disorder as well.
That's so true. And I think as we grow older, the stress just seems to pile up, and either we adapt to it or we lose, right? And so, like, is there a way that like we just become resilient to stress, or does it, then turn the autoimmune condition back on? Like, because I mean, like you said, there's some stress that's good. And is it good to adapt to this stress? Because, otherwise, how can we master challenges? How can, people like be more competitive or like reach certain goals without having that stress component, you know?
Yeah, that's a great question. So, we do want to be able to have a series of tools that help us manage stressors. So that is kind of, I would say 100%. We want to be able to have different things that help us to manage. So I don't know that we can necessarily, part of it, I guess, is adapting to it, but, life is always going to have stressors. That is a given, and this is true for everyone. And so it's not so much about trying to not be stressed or not have stressors, but more so to feel confident that we have the tools to manage. And so, kind of having a variety of different things that we can use. And the other piece of that too is, when is it too much stress? When you're having those symptoms that we just talked about. So let's say your mind is racing and you can't fall asleep because of that. That's telling us that this is not that helpful kind of little boost, kick in the butt stress. This is now becoming a problem. We want to address it. Or let's say that you're having constant kind of chronic stomach issues due to really high stress, poorly related stress. That's going to be something that we're going to want to address. And so, a lot of people, unfortunately, they kind of adapt to these things. So they kind of are almost used to it, and they don't necessarily know, like, I don't have to live my life this way, because it has become so chronic, and they just are so chronically sleep deprived, or they just have these kind of, let's say, stomach issues, that sometimes I think people adapt, but not in a way that is the most helpful in the long run, if that makes sense.
That's so true. Yeah. I mean, and it's I think it's hard to really recognize what's helpful and what isn't, like, unless we're really have that, mind body awareness.
Mhm.
And I think it's teaching us that at a point where, like, we really need to be aware of our bodies. And, when the body says it wants to sleep, it's time to sleep. Like, don't keep going, right? That's what I learned. Like, if I can't do another set at the gym, it's like a day. Basically, I'll come back tomorrow and start a new day. Like, I don't go beyond that.
Absolutely.
And so, especially with these conditions. But yeah, you've mentioned so many great tools and tricks and tips that people can use. What are your three biggest takeaways from our conversation?
Three is going to be hard, but let me think about that for a moment, because there's so many helpful things. I think number one, I think considering management of everything that's going on right now, I'll really encourage people to look at it as a puzzle with a lot of pieces on it. So we can't just kind of take one puzzle piece and expect that that's going to be the thing. It's really a combination of a bunch of different kinds of puzzle pieces. How do we put them together to match your life? Because it's going to be different for everyone. People have different things going on. So that's one thing that I would encourage everyone to consider, is what aspects of my puzzle maybe aren't there. So am I not having that social interaction? Am I kind of engaging in behaviors that maybe aren't very supportive for mood? Are there new things I could add? Do I have kind of a handle on maybe some of the thoughts that come up when we do feel stressed or anxious? So kind of gathering all these puzzle pieces and putting them together, that's ultimately what's going to be the most helpful. What goes along with that as a number two is consistency is key to management of really anything. And so that's where that piece comes in, is we want to be kind of proactive and put things in place with our different puzzle pieces on a regular daily basis, weekly basis. And so we're being consistent with these things, and we're not only addressing them when we kind of have no choice to, and they're already really, really kind of interfering. So prevention and consistency is just really kind of the keys to success. And so doing these things, not just out of necessity, but as a kind of a lifestyle approach, I think that's going to be a really, really helpful piece for everyone to consider as well. And then the third piece is, I just want to just kind of, encourage people and reassure them that there really is a lot that can be done for stress, anxiety, depression, coping, any challenges around that. These things are very, very treatable. Outside of medication, there's just a ton of things that you can do for it. And kind of all of the things we talked about today, we talked about them, of course, more generally, but these are all the different puzzle pieces that when you can figure out how to make them work for you, you can feel a lot better. So you don't need to struggle, and there is a lot that can be done to help you feel better.
Absolutely. I mean, even at times when I did feel alone and had this disease, I would just make a list of things that made me happy, chocolate, salsa dancing, like whatever it may be. And I'm like, what makes me happy? And then kind of just do one of those things, when I start going down that what if train. So it kind of refocuses your thoughts again. But yeah, in terms of results, like that's the last thing I want to cover in our conversation. And I think that results matter to people who have these chronic conditions. So maybe you can go over like a couple of client case studies. What have you seen out there? And what kind of results have been achieved?
In terms of just like overall management or mood management?
In terms of like, anyone that has had Hashimoto's or an autoimmune condition, and yeah, in terms of like the whole reversing that mood management.
Mm-hmm. So, I mean, I think, this is something that I would say probably I work with people on a weekly basis. So there's probably a lot of different kind of examples that I could give. But I would say just to start more generally, and then I'll kind of speak more specifically. But the people who have the best results are the ones who are consistent with the skills. And so that is ultimately what's going to get the best results. And so, I always like to encourage people to think about, if you are working with someone, think about that person as your guide, your supporter, your cheerleader, your perhaps accountability partner, you're someone to kind of show you these things and help you put the puzzle pieces together. But ultimately it's what you're kind of doing in the everyday with consistency. That is what's going to drive results. And so I always like to emphasize that first as the most important thing, and really kind of doing these things with consistency. That is what's going to get the best results. But in terms of, just some examples I can share, recently, so one of my I'm still working with her, but one of my recent people, she is 30 years old with an autoimmune disorder. And, kind of a lot of the things that I talked about today, there has been a lot of focus on how her life has changed and the things that she can't do anymore. So she used to be very heavily involved in athletics. And so that's something that she feels like is just not, it's just difficult for her to do. So there's just been kind of a lot of focus on that, and really starting to kind of establish, who am I at this point in my life? Where do I want to focus my attention and energy? On the days when I am, let's say, having a flare up or I'm not feeling as good, what is going to be the things that are going to help me to be successful in that day? So something that we've worked on a lot is kind of different levels of strategies. So on a day where we're feeling like, let's say, our absolute worst, what are things that we could still do? On a day where we're feeling kind of maybe not at our worst, but feeling not so good, what are things that we can do to support our mood management? So we've done a lot with that, and having kind of quick, easy things to access that can be used on the days that are going to be harder, because it's expected some days will be harder. But also, spending time in what, you were an athlete for a lot of your life. You're feeling like that's not, what makes sense for you at this point. How do we start to do things that still give you value, that you enjoy, that you can do even if they are differently? And how do we start to kind of shape your confidence and identity around that, even if it is different than something that's been in the past for you? So that's kind of, I think she's a kind of a good example of kind of all of the above. But she, I will say, I think she's had a lot of results because she really puts the work into it. And in the beginning, especially any new tools, I think it does require a little bit more kind of attention. But once you make these things a part of your routine, they don't feel like you have to do them so much. It just becomes kind of more of a consistent thing. So we've spent a lot of time also talking about, how do we make some of these tools work for you, where they are just a part of your routine rather than things that you're feeling like you have to think about and do as actively.
Exactly. And I think that, when you put it in that sort of perspective, it makes it a lot more feasible for someone who has all these overwhelming things coming at them at once, and their mind just doesn't stop, and it's really helps them sort of compartmentalize, what's the importance of this sort of thinking, and how can I sort of structure it better so I don't feel this way?
Mm-hmm. Mm-hmm. Yeah, and on the topic of consistency, I can think of someone else I've recently worked with. She's kind of tried all of the above. Let's say she's tried the deep breathing, she's tried, the physical, having more physical activity, watching what she eats, but it's been this very sporadic thing that's usually a reaction to really high levels of anxiety or really high levels of stress. And so, a lot of, our work together has really been just helping her to understand the importance of kind of not only the prevention piece, but also the consistency piece, and seeing, how can we make these tools that you already know actually how to do, but how do we make them work for you in a way that's going to really save you a lot of distress, time, energy. And so sometimes, a big part of the process with helping people get results is figuring out, based on you, your lifestyle, your preferences, what you can do, how do we make this work for you? Because it's going to be different for everyone. So I think a big, back to your question about results, is I think a big piece of results is making sure that we are putting things in place that make sense for the person and that they can actually do with consistency.
I love that. Yeah, I think that's very important, that it's not so cookie cutter and generalized, and there are options and it's tailored to the person. I mean, everyone is so different. So
Mm-hmm.
that's amazing. And just to end the interview here, if anybody wants to get in touch with you, how do they get in touch with you?
Yeah, so you can visit my website at drjuliakogan.com. It's Kogan. You can also follow me on Instagram. I like to share just kind of general stress tips, anxiety management tips there. So my Instagram is the same as the website. So Dr. Julia Kogan as well there. So on the website, if you want to directly contact me, there are some contact forms there. And then also on Instagram, you can always send me a direct message if you have any questions about anything, or if there's anything that I could do to help support you or, guide you further.
Thank you so much, Dr. Julia. And you have given us so much information today. I'm sure that everyone's going to be able to take some notes and then be able to contact you. And hopefully we can have you back again.
Yes, I'd love to be back. And I feel like I kind of had a volcano of information, so hopefully it wasn't too much. But as you said, I'll encourage anyone watching this, see if there are just one or two things that you want to kind of focus on and that you pulled from this, even if there's a few of them. But I would encourage you to focus on one or two and kind of focus your attention there. And even just making some of those small changes can really make a difference. So I'd love to be back if there's any specific topics that people would want to learn more about.
Great. Thank you so much.
Thank you.